Talking about the contraceptives. So contraceptives, they are the preventive methods that help the woman avoid unwanted pregnancies. It contains both temporary as well as permanent methods. What are the characteristics of an ideal contraceptives? तो ideal contraceptives के जो characteristics होते हैं, that is this contraceptive is safe, effective, acceptable, reversible होना चाहिए, long lasting, and no supervision should be required at the time of intercourse. So what do you mean by a conventional contraceptive and what are the examples? So conventional contraceptives are those contraceptives that you use during the time of sexual intercourse. So these are those contraceptives that are used during the time of sexual intercourse. What are the examples? The examples include the condoms, spermicides, jellies. And then what do you mean by cafeteria choice? So cafeteria choice is to provide all the available contraceptives and make him or her choose between according to his or her choice. So that is called as cafeteria choice. But however, nowadays gather approach is used as compared to the cafeteria choice. Now there are different types of contraceptives. So the types of contraceptives, they can be based on spacing methods or terminal methods. In spacing methods, you have barrier methods, intrauterine devices, then the post-conceptional or post-coital hormonal contraceptives, or some miscellaneous methods. And in terminal methods, obviously vasectomy and tubectomy are present. So talking about the first, in the first we have the barrier methods or the occlusives. So in the barrier methods or the occlusives, the first is the male condoms and female condoms. So barrier methods, the main contraceptive advantage of this method is that there is absence of any side effects. So there are no side effects that are seen with the barrier methods as they are seen with pills or IUCDs. Also they protect from the cervical cancer. Now talking about the first, that is the male condoms. The male condoms are made up of latex. It is marketed under Nirodh, under the social marketing program, which is under the Ministry of Health and Family Welfare. The failure rate of male condoms, it is 2 to 14 per 100 women years. Then the most common cause of failure is not the tear of condoms, लेकिन जो most common cause of failure है वो है the improper usage of condoms. The advantage is it is easy to use, no supervision is required, inexpensive, right? The non-contraceptive advantage is that it protects from the STDs, very important, as well as the pelvic inflammatory diseases. Disadvantages: it tears, interferes with the sex sensation. It is manufactured by Hindustan Latex, Trivandrum and London Rubber Industries in Chennai. Number of condoms needed for effective protection in India, this is very important, that is 72. Female condoms, these are the reusable condoms, very important. The male condoms are not reusable. The female condoms, they are reusable. They are also called as, they are under the name velvet. It is made up of nitrite, that is FC2, or it is made up of polyurethane, that is FC, pre-lubricated with silicone, and the spermicide is not needed. This is the only tool which the woman can initiate on her own and control the spread of HIV infection. So this is very important. The failure rate, however, it is 4 to 20 or 5 to 21 per 100 woman years. The inner ring, it covers the cervix, while the outer ring, it is present outside the vagina. It was invented by Danish MD Hessel. It protects from pelvic inflammatory diseases and sexually transmitted diseases. So this is the female condom and this is going to be the male condom. So in the female condom, this inner ring is present that covers the cervix, and this outer ring that is present outside the vagina, and this is the male condom. It consists of only one end. Now the next important thing about this particular MCQ: a 26-year-old woman at 6 help from gynecologist regarding the contraceptives. She recently became sexually active with her boyfriend. Her menstrual cycle is regular, lasting 28 days. The boyfriend has a history of IV drug abuse and has a latex, but however she has latex sensitivity. So which is the incorrect statement? A female condom can protect against STDs? Yes. Failure rate for female condoms is 4 to 25 to 21 per 100 women years? Yes. A female condom can be used in case of latex allergy? Yes, because it is mostly made up of polyurethane or nitrite. Male and female condoms combined will have extra protection from STDs? No. Both of them independently protect from STDs, but combined effect will be more. This is not seen. Then, जो barrier methods में आगे है, that is the diaphragm or the Dutch cap. The failure rate in diaphragm or Dutch cap is about 6 to 12 per 100 women years. It protects from the pelvic inflammatory diseases or the human papilloma virus. It is always used in conjunction with spermicides. Remember, very important thing. The Diaphragms act as the vaginal sponge. Both of them, they are always used in conjunction with the spermicide. However, on the other hand, the female condoms, they do not require a spermicide. Then they are to be placed before intercourse and they are to be left for a minimum 6 hours. अगर 24 घंटे से ज़्यादा रखोगे तो ऐसे कंडीशन में टॉक्सिक शॉक सिंड्रोम होने के चांसेस होते हैं. Advantages, there are no side effects just like all the barrier methods. Disadvantages क्या होता है? It require a technical expertise and it should be done after the involution of uterus. तो after the puerperal period. और दूसरी चीज़ क्या है कि प्रेगनेंसी के टाइम पे आप इसको फर्स्ट ट्राइमेस्टर में या सेकेंड ट्राइमेस्टर में सेक्सुअल इंटरकोर्स के टाइम पे इसको नहीं इस्तेमाल कर सकते. It is held in position by the tone of the vaginal muscles and the tension in the string. Then what is it made up of? It is made up of a synthetic rubber. Now the variations, it is present as a cervical cap, vimule caps or walls. Now the next is the vaginal sponge. It is marketed under the name of Today. Then the spermicide used is the non-oxynol 9, very important. Non-oxynol 9 is used as a spermicide. This is made up of polyurethane and the failure rate. Now here the most important is failure rate. It changes according to the parity. So nulliparous woman के लिए होता है 9 to 20 per 100 woman years and for multiparous woman it is about 20 to 40, so like double. So this is far less effective than diaphragm. आप देख सकते हो कि failure rate काफ़ी ज़्यादा है. Also it has no protection from STDs or HIVs. It is to be placed before intercourse, again left for minimum 6 hours for its action and 24 घंटे से ज़्यादा नहीं रखना है हालांकि because it can lead to toxic shock syndrome. Now both of these products, that is diaphragms or the Dutch cap as well as the vaginal sponge, these are available under the National Family Welfare Program. Now these are the diaphragm, this is the cervical cap and this is the vaginal sponge. हालांकि they require technical expertise and because of which their use is less. Now these are all the physical methods in the barrier method. Also the barrier method consists of chemicals. So chemical it consists of the spermicides, creams, paste, jellies. What is the mechanism of action? These are the surface active agents. They attach to the sperms and inhibit the oxygen uptake and thereby killing the sperms. They're best used in conjunction with the barrier. So generally the spermicides are used with these diaphragm, stretch caps or the vaginal sponge, or they can be used with condoms as well, but no big difference. हालांकि they cannot be used alone because there is no efficacy. Disadvantages, it leads to burning sensation, irritation and it may be teratogenic for the women. Now talking about the second barrier, जो दूसरी स्पेसिंग मेथड है दैट इज़ इंट्रायूटेराइन कॉन्ट्रासेप्टिव डिवाइसेस. सबसे पहली बात जो हमें याद रखनी है कि जनरली द इंट्रायूटेराइन डिवाइसेस, कॉन्ट्रासेप्टिव डिवाइसेस, दे आरंट गिवन इन नल्लीपैरस वुमन. तो नल्लीपैरस वुमन को हम लोग नहीं देते. इट इज जनरली यूज्ड इन मल्टीपैरस वुमन ओनली. नाउ द इंट्रायूटेराइन कॉन्ट्रासेप्टिव डिवाइसेस दे आर फर्दर डिवाइडेड एज फर्स्ट जनरेशन, सेकंड जनरेशन, थर्ड जनरेशन. तो सबसे पहले बात करते हैं फर्स्ट जनरेशन. फर्स्ट जनरेशन जो होता है उसके अंदर कुछ नहीं होता. सो द एग्जांपल्स ऑफ दिस दे आर गोइंग टू बी द लिपेज लूप or Grafenberg ring. So this is a Grafenberg ring and this is the lipase loop. We can see the double S shaped loop. So it is made up of polyethylene. And what is the shape of the lipase loop? It is double S shaped. Then what does it contain? It contains barium sulfate. Why is this barium sulfate is there? It helps in X-ray observation, ताकि X-ray में समझ में आए कि ये जो इंट्रायूटेराइन कॉन्ट्रासेप्टिव डिवाइस है वो अंदर है कि नहीं. Then the failure rate of lipase loop जो है वो है लगभग 3%. So that is the maximum in considering the intrauterine contraceptive devices. So maximum chances of pregnancy or maximum chances of failure are present in this. Now there is a tail of loop. ये जो tail of loop है it hangs outside the vagina. What is its importance? Obviously it will reassure the woman कि जो IUCD है वो उसके अंदर ही है. और दूसरी चीज़, उस टेल को अगर खींचोगे तो वो बाहर निकलेगा. सो दैट इज़ we can remove it. The mechanism of action, foreign body reaction, induces biochemical or cellular changes in the uterine fluids, impairs the viability of gamete, and very important is that it reduces the chances of fertilization and not implantation. The chances of implantation, they are reduced in OC pills, while in intrauterine devices the chances of fertilization are reduced. What is the lifespan? It can be used as much as you can until there is no adverse effects or side effects. So ये एक important advantage होता है लिपेज लूप का. जबकि second generation और third generation ICDs they have got a particular lifespan. Why? Because they contain certain things like second generation contains copper, third generation contains hormones. तो जब hormones ख़त्म हो जाएंगे तो lifespan भी ख़त्म हो जाएगा. There are 4 sizes A, B, C, D, while D is the largest. मोर द साइज लेस इज फेल्योर, लेकिन प्रॉब्लम यह है कि मोर द साइज इट विल कॉज पेन ब्लीडिंग, जिसकी वजह से रिमूवल रेट भी ज़्यादा होगा. देन नेक्स्ट इज द सेकेंड जनरेशन IUD which is has copper in it. Now here you can see this is a copper 7 which looks like a 7. Then there is a copper T200, then there is copper T220B and copper T380A. What does this T stands for? T is nothing but shape. 380 is nothing but the surface area of copper, जिसके ऊपर copper लगाया हुआ है उस copper का surface area. A stands for Ag, that is silver. The lifespan of copper T380A, it is 10 years. And the failure rate, जो failure rate है इसका वो बहुत कम है, that is 0.5 to 0.8%. There is a ball at bottom. So this ball at bottom, it helps to prevent the perforation and the pain that is caused because of it. It is included in the National Family Welfare Program in 2002. Why? Because it has got a high efficacy, it is long acting, 10 साल तक चलता है, and it has got low expulsion rate as well. Then this is something NOAA T. So the important about the NOAA T is that we can see that there is a silver core. And what is the lifespan of NOAA T? It is again 5 years. Then multi-load 375, again the 375 stands for the surface area of copper. It is inverted U-shaped, here we can see. And what is the lifespan of multi-load 375? It is again 5 years. Mechanism of action, the best mechanism of action is the foreign body reaction. Apart from that, the copper, it alters the cervical mucus, affecting the sperm motility. It makes the mucus more thick. Advantages, it has lower incidence of failure, lower expulsion rate, low incidence of bleeding and pain, and also it can be used as a emergency contraception. Then there is something called as Gynefix. Gynefix is embedded in the myometrium. It is fixed inside the myometrium. फिर उसके बाद थर्ड जनरेशन IUCDs. इन थर्ड जनरेशन IUCDs they consist of Progestasert 65, Progestasert LNG20. So Progestasert is the one of them. So what is Progestasert? It is a T-shaped, as you can see over here. It contains about 38 milligrams of progestogen and releases 65 microgram. तो ये जो 65 मैंने डाला है, वैसा नाम नहीं होता इसका. So 65 micrograms of progestogen is released each day. Why most widely used? First introduced in 1976. 1976 में और क्या हुआ था? नेशनल पॉपुलेशन पॉलिसी आई थी. और 1977 में क्या हुआ था? स्मॉल फैमिली नॉर्म आया था. राइट. नाउ द फेलियर रेट. सो फेलियर रेट जो होता है इसका वो 1% के अराउंड होता है. इट हैज़ गॉट द लोएस्ट एक्सपल्शन रेट एंड द लोएस्ट रिमूवल रेट. अब इसका मतलब क्या है? सबसे पहले तो व्हाट डू यू मीन बाय फेलियर रेट? फेलियर रेट मतलब क्या है कि देयर आर चांसेस ऑफ प्रेगनेंसी दैट मे हैपन, सो दैट इज डिनोटेड बाय द फेलियर रेट. सबसे कम फेलियर रेट किसका है? LNG20 का है. राइट. देन व्हाट डू यू मीन बाय एक्सपल्शन रेट? एक्सपल्शन रेट मतलब स्पॉन्टेनियस एक्सपल्शन, मतलब आपने डाल दिया और वो अपने आप ही बाहर निकल गया, उसको कहते हैं स्पॉन्टेनियस एक्सपल्शन रेट. फिर उसके बाद होता है रिमूवल रेट. व्हाट इज रिमूवल? रिमूवल इज वॉलंटरी. ठीक है ना. अगर उस वुमन ने निकाल दिया उसको तो दैट इज कॉल्ड एज रिमूवल. वेल एक्सपल्शन इज इनवॉलंटरी, इट इज स्पॉन्टेनियस. जबकि रिमूवल जो होता है वो दैट इज वॉलंटरी. रिमूवल इज जनरली बिकॉज ऑफ पेन, दैट इज बिकॉज ऑफ द IUCD. सो लोएस्ट रिमूवल रेट एज वेल एज लोएस्ट स्पॉन्टेनियस एक्सपल्शन रेट जो है वो किसका है? प्रोजेस्टेसर्ट का. लाइफ स्पैन कितना होता है प्रोजेस्टेसर्ट का? अबाउट 1 ईयर. उसके बाद LNG20 और मिरेना, इसका लाइफ स्पैन होता है 5 to 7 years. इट इज़ कर्व्ड. सो हियर यू कैन सी दिस इज कर्व्ड. वेल दिस इज कंप्लीट T-shaped. इट कंटेन्स 52 milligrams ऑफ लीवोनॉर्जेस्ट्रल और रिलीज कितना करता है? 20 micrograms ऑफ लीवोनॉर्जेस्ट्रल ईच डे. द फेलियर रेट कितना होता है इसका? फेलियर रेट जो होता है इसका 0.2% के अराउंड होता है. सो इट्स द लोएस्ट फेलियर रेट, बट हाउएवर इट हैज़ गॉट द हाईएस्ट रिमूवल रेट, क्योंकि पेन होता है इसके वजह से. सो देयर इज द हाईएस्ट रिमूवल रेट. What is the mechanism of action? It increases the viscosity of cervical mucus. It maintains a high level of progesterone and low level of estrogen, thereby making it unfavorable for implantation. Now, the ideal candidates for IUDs are the parous women. So generally we know that, मैंने पहले ही बता रखा है कि नल्लीपारस वुमन में हम लोग उसको नहीं डालते. यंग वुमेन के अंदर भी हम लोग उसको प्रेफर नहीं करते. Why? Because there are chances of removal. Then normal menstrual periods. Those who are willing to check the tail of IUCDs and there is no history of pelvic inflammatory disorders. Now what are the adverse effects? The adverse effects that are associated with this, they are the BPUPE. So B stands for bleeding, P stands for perforation, UP stands for uterine perforation, E stands for ectopic pregnancy. So B जो होता है that is bleeding is the most common adverse effect, while जो P होता है that is pain is the second major effect. But however, this is the most common cause of removal. The pain is the most common cause of removal of ICD. Uterine perforation, this generally happens during the first week after insertion. And the pelvic infection, this is seen because of multiple sexual partners. So what are the contraindications? जो adverse effects होंगे वही contraindications होंगे. For example, bleeding हो रहा है. So if there is a vaginal bleeding that is already present, don't put ICDs. Don't use it in nulliparous women. जिसको कार्सिनोमा है, जिसको ट्यूमर्स है, उसमें इस्तेमाल करना. If there is a history of previous ectopic pregnancies, then don't use it. And also of women with multiple partners, उसमें भी मत इस्तेमाल करना because there are increased chances of pelvic inflammation. Then the pregnancy with IUCD in situ. So the intrauterine device is present in situ and if the woman gets pregnant. Now this is because of the failure of that device, right? So if she wants to abort it, she can abort it. If she wants to proceed with pregnancy, चल ठीक है कर लेते हैं. And the threads are visible. जैसे कंडीशन में क्या होता है तो mostly the females they remove the threads, but this can cause problems. If she wants to continue pregnancy and the threads aren't visible, then she is worried कि क्या ये पहले ही एक्सपेल हो चुका है या अभी भी मेरे अंदर है, बस थ्रेड्स ही नहीं दिख रही. So they should visit a gynecologist and a uterine examination is done. But however, the abortion is not done in the second trimester. There is a higher risk of spontaneous expulsion in young women, nulliparous women, and when using a non-medicated IUDs. Then अब सबसे इम्पॉर्टेंट चीज़ है IUCDs के बारे में, जहाँ से मोस्ट ऑफ द MCQs दे कम फ्रॉम दिस पर्टिकुलर पेज. तो सबसे पहले जो है what is the ideal time of insertion of IUCDs? The most ideal time is during the menses, that is within the 10 days. Okay, the risk of expulsion, it is low in this particular time. The receptive time is considered to be the postpartum, that is within 1 week after delivery. The risk of expulsion as well as the risk of uterine perforation, however, they are high because here the uterine involution gets started and because of which the risk of perforation is high and expulsion. Convenient time is postpartum period. Then postcoital, it should be done within 3 to 5 days. It is generally used for as a postcoital contraceptive. Generally copper containing IUCDs are used. Post abortion, it is allowed till first trimester, but it is not allowed till in second or third trimester. What are the PID causing organisms? They are the Gardnerella, Actinomyces, bacteroids, Trichomonas. Now very important, regain of fertility. So generally if the IUCDs are removed, then after 1 year, in 70% of the women, they regain their fertility. Now, before moving to highest expulsion rate, lowest expulsion rate, highest removal rate, lowest removal rate, the mnemonic to remember this is progestacid, right? This progest over here. So R stands for the removal rate and expulsion rate. So this is the lowest removal rate and lowest expulsion rate. So lowest removal rate is of progestacid and highest and the lowest expulsion rate is also of the progestacid. So progestacid and here also there is progestacid. Now talking about the lipase loop, you can remember the lipase loop as lipase loop. So F stands for failure, so highest chances of failure, and E stands for expulsion. So highest chances of failure and high expulsion rate, it is found in lipase loop. So highest failure rate is seen in lipase loop and highest expulsion rate is also seen in lipase loop. Now remaining, that is highest removal rate and lowest failure rate, it is seen in LNG20, both LNG20. Now we know that the lowest failure rate is of LNG20, that is 0.2%, and the highest removal rate, it is also seen in LNG20. How to remember this? So LNG, it looks like LPG. So we have those LPG cylinders in our home. हम क्या करते हैं, उसको बाहर निकाल देते हैं. That is, हम LPG cylinders को बाहर निकालते हैं, voluntarily बाहर निकालते हैं. So that is highest removal rate, it is seen in LNG20. Now the next is the lifespan of different IUDs. So we already discussed it. Copper T388 का है 10 years, Nova T का है 5 years, Progestacid का 1 year और LNG20 का 5 to 7 years का होता है. What are the non-contraceptive benefits? It can be remembered by a mnemonic called as HEMA. So H, it stands for hormone replacement therapy. E stands for endometrial cancer or endometriosis. Then the N stands for menorrhagia. A stands for Asherman syndrome, anemia, and another A stands for adjuvant therapy to tamoxifen. So these are all the uses of non-contraceptive uses or benefits of using IUCDs. The OC pills, the hormonal contraceptive methods, that is OC pills and depot formulations, they will be discussed in the next video.